You're watching the latest edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Daniel G. Amen, MD. Dr. Amen is a child and adult psychiatrist, brain imaging specialist, best-selling author, and medical director of Amen Clinics in Newport Beach and Fairfield, California, Tacoma, Washington, and Reston, Virginia. Dr. Amen has pioneered the use of brain imaging in clinical psychiatric practice. His clinics have the world's largest database of functional brain scans for neuropsychiatry. In addition to his private practice, Dr. Amen is an assistant clinical professor of psychiatry and human behavior in the University of California, Irvine College of Medicine. He is a best-selling author with over 20 books written, including the New York Times bestseller, Change Your Brain, Change Your Life. Dr. Amen, together with the United Paramount Network and Lisa Gibbons, produced a show called The Truth About Drinking on Alcohol Education for Teenagers, which won the Emmy Award that year for the Best Educational Television Show. Dr. Amen, welcome to the show.
Thank you.
We've invited you on the show today to talk about ADD, one of the things you specialize in. Or is this your specialty?
Well, we've seen more ADD people and scanned more ADD brains than anybody in the world. So it's one of the things that we really do well, is diagnosing, treating, understanding, and helping people who have attention deficit disorder.
How big of a problem is ADD?
It's a huge problem. It's estimated that somewhere between 5 to 10% of the childhood population has it, and most people who have it as children continue to have symptoms as adults. It's estimated that it affects somewhere between 17 and 30 million Americans today.
Now, there's a standard of care, I guess, the standard treatment for ADD, and then you told me on the telephone, your treatment is a little different. How so?
Well, most people who get diagnosed with ADD get stimulant medication. That's the standard of care, and that's pretty much it. When what we have found is ADD is not one thing, it's at least 6 different things, and giving everybody the same treatment makes some people better and a lot of people worse. So it's more complicated than you have ADD, take Ritalin, or you have ADD, take Adderall. Those are stimulants.
And that's what happens.
And that's typically what happens.
What frustrates you about that? And that's going on, I guess.
Well, you know, medication for people who have ADD is very controversial. And it's controversial because it makes some people worse. And what's frustrating to me is we're diagnosing people based on symptom clusters rather than looking at the brain. No other medical specialty acts like psychiatrists do. Here are a group of symptoms. Here, take this medicine. When these symptoms could be due to a wide variety of problems. I mean, just take the concept of chest pain. If you had chest pain, well, people know, well, that could be heart disease, but it could also be gallbladder disease. It could be you have an ulcer. It could be you got hit in the ribs.
Okay.
One treatment does not fix chest pain, and one treatment does not fix attentional problems.
So what's the answer?
Well, the answer is to know what type of ADD you have and target the treatment to the individual, target the treatment to the right type.
By imaging the brain.
Imaging the brain is very helpful because it allows us to act like medical doctors and to look at what we do before we actually do it.
Anticipating this interview, talked to a lot of people about ADD. People that said they have ADD, their children have ADD. And I said, were they ever scanned? Any type of SPECT scanning? And every one of them said no. I said, was it ever offered to you? They said no. Are you one of the only people? I mean, is it common, not so common, that you're doing images of the brain?
It's not common. There are about 10 of us around the country that do this, and we sort of lead the way. We've done more of it than anybody because we have a passion to look at what we do before we do it. We think it's a little bit insane not to.
Sure. You said you're the only medical specialty, psychiatry, that doesn't look at the organ they treat. Tell me about that.
Well, it's silly, but it's true. If you try to kill yourself today in Los Angeles or in Seattle or in Washington, D.C., virtually nobody will look at your brain. Even though you might have a tumor, you might have had a head injury, you might have bipolar disorder, nobody's looking at the organ that's responsible for behavior. If you kill 6 other people, the prosecutors will try and keep imaging out of court.
Interesting.
And go, well, what does that have to do with anything, even though we know the brain is the organ of behavior?
What happens if ADD goes untreated?
Well, what a lot of people don't know, a lot of people think ADD is sort of a fad. It's sort of a mild thing. What they don't know is the statistics. When people with ADD are not treated, 35% of them never finish high school. Nice kids, bright kids. But they can't do boring things, so they don't finish high school. 52% of untreated ADD adults abuse drugs and alcohol. If you have a hyperactive, aggressive child, there's a 40% chance he'll be arrested for a felony by the time he's 16. And 75% of untreated ADD teenagers and adults have interpersonal problems. They have problems in relationships, in their marriage. They have problems at work. Untreated ADD people, they make less money, significantly less money, given the same intelligence and education in their life. And they use medical services twice as much as other people because they get hurt more often, they're under more stress, their immune systems are
So what do you say
more
to the parent watching this that just says, well, my kid is just a bad kid or just gets into trouble all the time? Is earlier treatment better? Or do you think you could have an impact on any of this?
I can have a huge impact on their whole life. That's our experience in treating people at the Amen clinics for the last 15 years. I mean, it's not like we've just been doing this for 6 months. We've been doing it for a long time. Left untreated, it's a disaster. But the exciting news is ADD is one of the most treatable illnesses today. People get dramatically better. Those of us that spend a lot of time treating people with ADD, we get very excited because we know with the right treatment we can change people's lives.
So the problem is misdiagnosis, improper diagnosis?
Well, it's using a one treatment fits everybody
Just
sort of
symptoms.
mindset. And it just doesn't work like that. People are more complicated. There's some people who have ADD, give them stimulant medication, changes their whole life in a positive way. There are other people who have ADD, by all the diagnostic criteria that we use, give them a stimulant medication, they'll try and hurt themselves, or they may try and hurt someone else. So it's one treatment doesn't fit everybody. You have to individualize treatment based on their brain and their situation.
So look at the brain first before you give any medication or any suggestions or any
That's
recommendations.
what we recommend, is brain imaging is very helpful, especially if it's complicated. Now, if you took your child to the pediatrician and he put him on medicine and he's dramatically better, you don't need a scan. Be grateful. I always say light candles at church.
Okay.
But if you got medicine and it made him worse, or things aren't getting better, that's the time to look to see what else might be going on.
So what could go wrong? And give me an example. Somebody, they go to a psychiatrist for medication for their ADD child, and but they don't do an image. What could go wrong?
Well, I have a 12-year-old patient. Her name is Lexi, and she's just a doll. But when she came to me, she was a hellion. She got diagnosed by her pediatrician with ADD, got put on Concerta, one of the stimulants that we use to treat ADD, made her very aggressive. A week later, parents pulled her off her medicine, and they took her out of treatment. And then they read my book, and they said, well, we'll try again. And when I saw her, she had this pattern we call the ring of fire, which is overall too much activity in the brain. I put her on a combination of fish oil and a supplement that I really like, taught her parents how to be more effective with her, taught her some self-calming techniques, and she's dramatically better. So,
Naturally.
naturally. Now, some people need medicine, some people can
So you
do it
couldn't have done that
medicine.
without the scan?
I couldn't have done it without the scan. I mean, I guess I could have continued to do educated guessing, but in my experience, before I did scans, it would take me sometimes a couple of years to hit the right treatment. And that frustrates people. I mean, a lot of people aren't willing, especially ADD people, because they're impulsive, they don't want to wait that long. And so if it doesn't work right away, they stop treatment.
So you think that happens and the parent says, I tried medication, it didn't work. In fact, it made her worse.
Absolutely. It happens all the time. It's
And it was
very
just the
common.
wrong medication.
And it was just the wrong medicine or the wrong treatment approach. One treatment doesn't fit everybody.
Okay, we're going to take a quick break. And you brought some images. We're going to look at the images, exactly what you're looking at, the brains. And you've identified 6 different, is it categories of ADD? Is that correct?
6 different types.
And we'll go over those different types. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking about ADD with Dr. Amen. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We are talking about ADD with Dr. Amen. Dr. Amen, with these images, they're used to diagnose and target treatment. Is that correct?
You bet. And SPECT is a special study that looks at blood flow and activity patterns in the brain. It looks at how your brain works.
So a patient has ADD. They go in, you've gone through the history. When does this come in?
Well, after we do a history, we then image them to see how their brain specifically works. And then we'll use those images to target treatment so that we're more effective. The other thing that the image does is it helps people accept the fact that they have a problem because they can see it. Rather than I give you these symptoms and then you give me this medicine. A lot of people don't believe what's going on. Showing them the images, it teaches them to be more connected to their brain, to the issues that their brain has. So they're more compliant with treatment. They're more likely to do what you ask them to do.
So it's leverage.
And they don't feel bad about it. There's this stigma that goes along with psychiatric illness. You know, if only I was better, I wouldn't have this problem. If only I tried harder, I wouldn't have this problem. But what we found in doing these scans is the harder they try, the worse it gets, and we can show that. And by recognizing that, a huge weight is lifted off their shoulders, and it's like, oh, I have a medical problem. You know, like if you need glasses, well, you feel bad about it, but then you wear them because you know it helps you. And the imaging really helps us to see ADD in exactly the same way.
You brought some slides.
Yeah, just to give you an introduction about what we do. And in this slide, it shows what SPECT, that it looks at blood flow and activity, provides a window into the soul. I mean, your very character actually shows up on these scans. And we've been doing this for a long time, longer than anybody. We've been doing it for 14 years.
What does that mean to the patient?
We've done 25,000 scans. What it means to the patient is that if they come see us, we have a lot of experience. It's not like we just opened up and we thought...
So there's a learning curve in reading these images.
Oh, absolutely. And I'm very different now, 14 years later, than I was at year 1, year 5, year 7 even. We've been able to recognize patterns. Plus, we're actively researching what we do, always trying to refine it. In the next slide, it's very simple to understand what we do. What SPECT scans basically look at are 3 things. Areas of the brain that work well, areas of the brain that are underactive, and areas of the brain that are overactive. That's pretty much it. Good activity, too little, or too much. And in the next slide, I showed a big picture of the camera, opposed to MRIs that people are afraid of because you have to go inside a tube and people get anxious and scared. You lay on a table. Your mother can stand next to you. It's not noisy. It's very quiet. It's an easy procedure to do. And a person lays on the table for about 15 minutes. Now, before they go on the table, they're in our prep room where we inject the medicine into their arm. So the hardest part of the procedure is they get a little tiny butterfly needle into a vein in the arm because we inject medicine that lights up the brain and actually shows us an image of a living, working brain. Now, what we see in a healthy scan, so if we look at a healthy scan, here we're looking at the outside surface of the brain, and this is one of our normal people. Not very many normal people in the world, we've come to learn.
Okay.
But what we see is full, even, symmetrical.
So what that
activity.
is blood flow.
We're looking
even
at
blood flow.
And when we see the abnormal ones, you'll see a huge difference. But what we see is good activity in the brain. Now remember, SPECT looks at 3 things. Good activity, too little, or too much. This view shows us when there's too little activity. This next view shows us when there's too much activity. So this is what we call our active scan. Where here blue is average activity, red are the hot spots in the brain.
So in those hot areas, those areas of the brain tell you what?
Well,
if they're hot in those
telling
areas.
us which areas are working really hard. And in a healthy scan, it's the back part of the brain that has this organ we call the cerebellum, back bottom part of the brain, that usually is the most active. In some of our types of ADD, we see that's not active at all. The front part is active, which goes along with getting worried and being obsessive and rigid, and if things don't go your way, you get upset. So this image helps us to see the hot spots in the brain. Now, when we look at scans for other things, I'll just show you a couple of other things to show how we look at it. This is somebody who had a stroke. Now, a stroke is where a blood vessel breaks or a blood clot goes and chokes off blood supply. And when you see the holes, what the holes mean is seriously damaged activity in that part of the brain.
So in those whole areas, if that may represent the memory part of the brain, you will know exactly what's going on.
Right. Since certain parts of the brain do certain things, what we now have are maps or targets on how those parts work.
Are you able to look at one of these scans and, like a fortune teller, go to the patient and say, do you have a problem with this, 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 and this? And they're saying yes, 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 yes.
Absolutely. We do that all the time, and people are like amazed. But how could it be otherwise? Because your brain controls behavior, and certain parts of your brain do certain things.
But these crystal clear images of the brain, what I'm having a tough time getting here is, why aren't all psychiatrists doing this?
Well, it's a good question.
Are they skeptical?
I've asked myself that question over and over again. And the answer, I think, is it's not part of their training. It's not part of their experience. It's not part of what psychiatrists do. So they've been very slow in getting it. And it used to really, really upset me. But what I find, because I talk to thousands of professionals, mental health professionals, psychiatrists, every year around the country, and I find that when they understand it, they get it, and then they get excited about it. So it's really something that is changing.
Okay, we're going to take a quick break. You're watching The Wellness Hour. I'm Randy Alvarez. We're here with Dr. Amen. We're talking about ADD. We'll be right back. You're watching The Wellness Hour. I'm Randy Alvarez. We're talking to Dr. Amen about ADD. Dr. Amen, with these scans, huge difference between a healthy brain and somebody that's had a head injury. Is that right?
You bet.
I mean, you can see the differences.
Absolutely. In fact, if we look here, these are 2 incidents of head injuries. The image on the left, this boy fell down a flight of stairs, had terrible behavior problems, and nobody really looked until 10 years later when he was in a residential treatment facility. I mean, it's amazing to me. We'll send kids off because they're so bad they can't live at home, but we won't look at their brains. I mean, it's just
So we're looking at a lack of blood flow. That's what all of these are.
Yes.
In that area.
The image on the right is someone who had a bicycle accident. People don't know that riding a bike is the most dangerous sport out there. There are more accidents riding a bike and so on. But if you've had a head injury, somebody should be looking at what you do. Like if you've been using drugs. What we found with drug abuse is the real reason not to use drugs is they damage your brain. And we can prove it. We've done a lot of work.
But can you really turn it around? I mean, these images seem pretty obvious here. But can you turn it around? I mean, somebody watching this, I mean, can you make a difference? Can you get it better? You call it healing ADD. Can you do it? I mean, do you see it every week? Do you see it every day?
We see it every day. That we take brains that are troubled. If we look at these drug abuse brains from cocaine, methamphetamines, alcohol, heroin, marijuana, stop. Get on a brain healthy program, and you can take some of this damage and make it significantly better. Now, the real reason not to start is you might not make it normal. You might not make it really, really healthy. And this information is critical. We actually have posters that hang in 20,000 schools. It's called Which Brain Do You Want? Healthy scans surrounded by toxic scans. But I know we're here to talk about ADD. And what we found in the imaging work is ADD is not one thing. It's 6 different things. And if you treat everybody the same, you'll make 2 of these types better and 4 of them worse.
And that's what's being done for the most part today.
That's what's being done. And that's why shows like Ricky Lake, I was on last year, they do shows, anti-medication shows. Psychiatric medicines are controversial. Heart medicines aren't controversial. Stomach medicines aren't controversial. Psychiatric medicines are controversial. Why? Because clearly there are people that they make better and many other people they make worse. And so that's why they make the front page of the Los Angeles Times. FDA warning, antidepressants in children. Why? Because we're taking a one treatment, fits everybody.
So would you say that 80% of the medications that are given may not be appropriate for their particular problem, one of these 6 problems?
Yes.
And that's why they're getting worse.
A significant percentage of patients, we're giving them inappropriate treatment, and that makes them worse, which then makes ADD controversial.
Okay, what are the 6 different types?
Well, the first type is what we call classic ADD. It's what people think of when they think of ADD. Restless, hyperactive, impulsive, can't concentrate, disorganized. And what we see on their scans is there's low activity, especially in the front part of the brain. So where the arrows are pointing to, that's in a part of the brain called the prefrontal cortex. It's our supervisor. It watches us. Low activity there, you have all the ADD symptoms. Now the exciting thing is this is a scan of the same person. The image on the left, his brain at rest. The image on the right, when he concentrates, you can see this dramatic shutdown of activity on the right.
You make them read a book? What do you do?
We have them do a concentration task. It's called a CPT. Okay. It's a computer test. But look, when we give them the right treatment, so this is the one that responds to one of the stimulant medications, brain is dramatically better. And this happens the next day.
And the symptoms go away?
And these medicines work almost immediately. It's very exciting.
And they're safe.
And they're safe when used for the right type. For the wrong type, they're dangerous medicines. Now in type 2, what we see is decreased activity sort of in the whole brain, short attention span, distractible, restless. Now, not hyperactive, not terribly impulsive. It's more they're sort of sleepy, sluggish, trouble getting them motivated. And these same medicines work very nice, as you can see in this image. This is actually...
Are these before and afters, by the way?
This is a before and after.
So you could take somebody with limited blood flow in those areas to that on the right.
One dose. This is my daughter's scan. And I knew she would get dramatically better when I saw this picture. Now, if we go to type 3, what we call overfocused ADD, what we see is too much activity in the front part of the brain. And these are people who have ADD symptoms. Plus, they're worried. Things don't go their way. They get upset. They tend to be argumentative, oppositional, hold grudges. Give them a stimulant. They get more focused on the things that bother them. So they get more anxious, more negative. So we don't want to do it. We want to give them a completely different type of treatment. The next type, we call this temporal lobe ADD, where there are problems in the temporal lobe where the arrow is pointing to. Now they have ADD symptoms, plus they're moody, they're irritable, they often have temper problems, they have memory problems, frequently learning problems, especially reading problems. Give them a stimulant, you can make them hallucinate.
So if this person walked into the standard of care right now, they would get one of these stimulant medications for ADD.
Right, and they might get more aggressive.
And then the parent may write it off as medication doesn't work for my child.
Right. And completely take them out of treatment. And then all those bad things we talked about earlier, from school failure, drug abuse, job failure, relationship failure, we're cursing them now with the side effects of having untreated ADD.
So with a scan,
you can better target treatment. So this next type we call limbic ADD. That hot area in the middle of the brain is the emotional brain. They have the ADD symptoms, plus they're sad, blue, negative. They're always looking on the negative side of things. Give them a stimulant, they get more negative. They have what we call rebound, which means it helps, but then when it wears off, they are much worse. Or the last type is this one we call the ring of fire. And in the ring of fire, there's overall too much activity in the brain. Now, why would you give somebody who has too much activity a stimulant in their brain? You wouldn't want to. It's a bad idea. And what we find is they have all the ADD symptoms, plus they're angry, they're irritable, they're oppositional, they're explosive. The world comes at them way too fast. And we give them things to calm them down. The patient I talked about earlier, Lexi, who got better on a group of supplements, this is the pattern that she had. Stimulant made her worse, we would have predicted that. But the supplements, natural supplements made her dramatically
Is that common?
better.
Psychiatrists, MDs using supplements, integrating it?
No. And it's because they don't know. It's not part of their training. At UC Irvine, where I teach the course on supplements. And a lot of psychiatrists just have no clue that things like St. John's wort works. But it's got to be for the right type. See, supplements, just because it's natural, doesn't mean it's innocuous. If you give St. John's wort to the wrong type, you'll make them worse too. And my worry is, you go to Walmart or the grocery store, pick up St. John's wort because you're feeling bad, and it may in fact make you suicidal, and nobody knows about it because people go, well, it's just food, it's just natural, it doesn't have side effects, and that's not true. You got to target the supplements to the type.
Does insurance cover any of this?
Often. It depends on your plan. On our website, you can see 300 images. You can take tests to see what parts of your brain...
You can test yourself to see if you have ADD.
Absolutely. And see what parts of your brain may or may not be working as efficiently.
Where do they start? With your book?
Well, Healing ADD is a great place to start. The website is another place to start. There are videos on the website that you can look at about the clinic, what it's like to have a scan, and so on.
Number one misconception, and we are out of time, about ADD.
ADD is not one thing. It's at least 6 different things, and one treatment does not fit everybody.
And get an image. I guess that's your message. Get an image of the brain.
When you're not sure if this is the right treatment for you, imaging the brain will better help you target treatment. And we can also see how do we do. So we do before scans and after scans to see, are we doing the right thing for you?
What do you say to the patient that they've had it 10 years, 20 years, they've gone to several doctors, they've never been offered a scan or an image of the brain? What do you say to them?
Well, it's a new technology. It's very exciting, but how would you know unless you looked?
Okay, great. Well, thank you for coming on the show. Very interesting, and we'll have to have you back.
Thank you.
You've been watching The Wellness Hour. I'm Randy Alvarez. If you would like information about future airings of this program or other show topics, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.